Hi, my name is Teresa Bufkin. I'm here today to insert an IV into my patient's right forearm. First of all, I'm going to review my physician's order. I'm going to gather my equipment, identify my patient, identify any allergies, ask my patient the state, name, and date of birth. Next, I'm going to go over the 5 rights, make sure the patient's the right patient, the right dosage, the right route, time, medication, documentation. Next, I'm going to wash my hands and I'm going to apply my clean gloves. Okay, next I'm going to apply my tourniquet. I'm going to observe the patient's arm to see from distal to proximal the site that I want to insert the IV. I'm going to make sure it does not bifurcate. Next, I'm going to use my ChloroPrep to cleanse the site. Friction rub to the patient for 30 seconds. And I'm going to dispose this in a biohazard bag. Next, I'm going to get my 20 gauge IV gel coat. I'm going to use my non-dominant hand to pull the skin taut, but I'm going to make sure not to contaminate the area I cleanse with the ChloroPrep. Then I'm going to insert, make sure the bevel's up, insert the needle at a 45-degree angle into the vein. Going to look for flashback in the chamber. Once I get flashback, I'm going to insert the IV onto the vein. I'm going to, while simultaneously removing the needle from the cannula. Next, I'm going to release the tourniquet while I put my non-dominant finger on the proximal end of the vein to occlude it. I'm going to remove the needle from the cannula and dispose it into the sharps container. Next, I'm going to get my tubing and connect it to the cannula while I'm going to secure the area with tape for just a moment to make sure it doesn't come out. Next, I'm going to get my syringe, and I'm going to clean the hub, scrub the hub, and then I'm going to draw blood for the blood cultures. Alright, once I get the blood from the blood cultures, I'm going to first check see if the patient's on any antibiotics. If the patient's on is not receiving any antibiotics, I would obtain the blood cultures in the red or blue tubing. If not, if the patient is on antibiotics, I would put it in the green tube. So the patient is not on antibiotics. I'm going to apply an 18 gauge needle to the syringe, and then I'm going to put it up into the blue and red tube. Next, I'm going to send this off to lab, and I'm going to dispose of this into a biohazard container. Most of the time you can only draw one, you can usually draw only one blood culture from the IV tube and then have to use another side to draw the second blood culture. So after that, I'm going to scrub the hub, and then I'm going to flush, I'm going to flush the line, the IV line, with 10 cc's of normal saline. Make sure it's patent. I'm going to assess the site for any signs of infiltration, any swelling, or anything. There is none. So I'm going to discard this into the sharps container, and I'm going to make sure that I occlude the tubing, and I'm going to apply the Tegaderm to completely secure the IV site. I'm going to remove the outer of the Tegaderm and put the date, time, and my initials. Next, I'm going to remove my gloves. I'm going to wash my hands. I'm going to document the site. No signs as it was an infiltration. It was a 22 gauge inserted into the right forearm. The patient tolerated it well. Only it was ×1 attempt. The patient's response said tolerated well, and that's it. Thank you.
Good job.